Hello, this is Jason Herrera, and this is my project on face transplant surgery. What is a face transplant surgery? A face transplant is a surgical procedure. The doctor replaces part or also all of a person's face. It uses face tissue from a deceased donor. Right, and very rare and complex surgery but helps people with severe facial damage.
Did you know? Many people think a face transplant is just putting someone else's face on, but it's one of the most complex surgeries in medicine. It's for people whose faces were badly damaged by trauma or disease, those who can no longer eat, speak, or smile. Doctors must find a donor with matching skin tone, bone structure, vessels, and nerves. In surgery, two teams work side by side. One removes the donor's skin, muscles, and vessels, while the other prepares the recipient by clearing damaged tissue. The hardest part is reconnecting hair-thin nerves and vessels under a microscope, like wiring and plumbing a new house. The operation can last over 20 hours. Afterward, patients take lifelong anti-rejection drugs and spend months in rehab relearning to blink, talk, and smile. A face transplant isn't just about looks. It's about restoring life. Before any major surgery, always consult a qualified doctor to be sure it's right for you. Did you know?
So yeah. Why would someone need this procedure? From severe injuries from burns, car accident, gunshot wounds, birth or defects, or diseases that destroy facial tissue. When normal, where you get a face transplant surgery when a normal or reconstructive surgery is not enough. A reconstructive surgery repairs damaged tissue using the patient's own body. So it's like a little fix. You should get skin from someone else. But when the damages get so long, right, you no longer could use your skin. Right, that's when the face with transplant replaces severely damaged facial tissue with a donor's tissue. Right, when your skin is no longer possible. What happens if someone can get this surgery? They can have trouble breathing, eating, right, or speaking, severe pain or infection, for emotional damage like depression, anxiety, and you're gonna feel insecure because your face is not, your face is not a regular face. It's all messed up due to the damages, and and just say hard time interacting socially. Right, you're gonna be insecure. You're not gonna want to go out and stuff. Who usually gets a face transplant? Adults. It's not really common in children, but of course children still could get it. People with extreme facial injuries, patients who are healthy enough for this surgery, because this is a very hard surgery. So doctors have to do many tests like on your blood, and heart to just make sure you could even get this surgery. Like your body could take the surgery, and people that are willing to take lifelong medicine, right? Because after you take this surgery, you have to take medicine, right, until your whole life basically, and the surgery is selected very few and careful, right? And the doctors have to very carefully select patients because not all patients are capable of having this surgery, and this word here, I don't remember how to say it, but that's the type of medication you have to take to prevent their body from rejecting the new face. Right, and this is a treatment procedure. This is not This does not diagnose a disease, but it is used to fix a serious problem to help restore function and appearance. Where is this procedure performed? Large hospitals or specialized surgical centers, operating rooms. Requires advanced medical equipment. Often takes 10 to 20 plus hours. So this is a very risky surgery. A lot could go wrong, but you should trust the doctors as they go to school to study it. But it's just a very long and hard procedure, as you can see. And this is a room, they do surgeries in. Who performs this surgery? Plastic surgeons, right? Transplant surgeons, anesthesiologists, or nurses and surgical technicians, and large medical teams up to 30 plus people. And this is just a few of them are working on the face transplant, right? And there's a face right there, and this is just a few. There's way more people that goes into it just to make sure your face gets fixed. Equipment needed, surgical tools. As you can see there, this is just a few, there's more, but yeah, you can see how much tools you need. And heart and breathing monitors, or IV line, and machine, and imaging equipment. And this is somebody getting it. As you can see, the face is not the best right now, but at the end, it will all come out and yeah, be fixed. But right, as you can see, on how many tools you need, this is a very hard procedure. How does the procedure work? How does the procedure work? Damaged facial tissue is removed, put donor face tissue in match and prepared. Doctors connect blood vessels, nerves, and muscles. Skin is very carefully attached. As you can see here, all the different blood vessels and stuff, it's a very hard procedure to do because the doctors had to line it up perfectly, right? Perfectly, so the face, the old face doesn't reject the new face. And as you can see in this picture, how many different just stuff and muscles are in your face and the nerves. It's a very hard procedure, and not everybody could do it, of course. And it's very risky because just if something goes wrong, who knows, the infections and stuff. It's a very hard procedure, but that's why you gotta trust the doctors. See, I guess this one, the patient preparation. Physical exams by the doctor, put mental health and blood tests all come into play, because every person's mental health, that they might be rethinking it and stuff and just not all there, and after getting it they might feel down or like hopeless kind of, because their face. And finding a matching donor is also very tough, because it's kind of hard to find the same skin color and somebody like just everything that comes close is kind of hard, and patient must agree to lifelong care. Or some people might not want lifelong care, so they might just stick with their face, but at the end of the day, they will need a new face because it's gonna it's gonna be hard to live with the face you have right now. Risk of face transplant surgery: infection, rejection of new face, a lot of bleeding, side effects from medication, and need for more surgery. So just everything I kind of said earlier, like the infection, and then not all the time the new face rejects it, but there's a chance that the face they put on you might reject it, right? Like causing diseases or new infections, right? And it just might not add up, and it might be worse, but that's the risk you kind of have to take to get your face fixed. The recovery: long hospital stay, months of physical therapy, takes time to regain movement. Most patients improve function, and I put this picture because it kind of shows the steps of the physical therapy, like what do you have to do to be good again. And that's kind of the same with the face. You have to work out your face and like learn how to eat and stuff. And step by step, so you could be good and healthy again, just like this dude in the picture. But what does it feel like? Surgery itself does not hurt because they put you in the medicine cord. Recovery can be painful, but emotional. Adjustment is difficult. Learning to use facial muscles again, could be difficult. And many patients feel hopeful because they see the difference, so they want to go to physical therapy and get better and better for themselves, so they could go back to their regular and normal lives. So it all depends, but if you stick through it and work hard, you'll be back to your regular self. How can the procedure be made easier? Pain medication, counseling and therapy, support from family, physical therapy, and regular doctor visit. So getting the support from your family is everything. They support you. You're gonna be more into it. You're not gonna be doubting yourself because you have so many supporters to fall back on. And just therapy and physical therapy, helping you get your mind right, your mental side right, and just everything plays into play too. Everything comes into place so the patient could feel more confident about themselves, about this procedure, right? And just feel better about themselves. I'm all in the whole. But does this improve a personal life? Yes, it does. It improves eating, speaking, breathing, boosts confidence, and helps people return to daily life. As you see in this picture, the dude, he didn't get a face transplant, but I'm using it as an example how after a face transplant, you might go out, talk to a girl, or go to the bar and just interact socially, But would I convince someone to get this? I'll only do it if it's absolute necessary. But when other surgeries do not work, of course, but requires a serious commitment, and this could be life changing, But at the end of the day, it shouldn't be up to me or you to decide. It should be it should be a decision made by the doctors, because they know a lot more than we do, of course. But it was definitely good to learn about this and see like what some people go through, and we're just very, or knock on wood, but we're just very lucky to hopefully never have to get this surgery in our life. Right, and this was actually the first person to receive a partial face surgery, right? Isabelle, right, Dinor, right, in France, France in 2005. This is her before and after. So it worked kind of good. It worked pretty good actually. But needed, right, after a severe facial injury. She said it was emotional, difficult at first, but later said she felt grateful and hopeful, of course, because she felt more confidence in herself and regained the ability to eat and speak better. Ending. Face transplants are rare but powerful, or help people with severe injuries, require advanced anatomy knowledge, involve risk and long recovery, can restore function and hope. Self-reflection. My favorite part of this project was learning about face transplant surgery, and how it can improve someone's life by helping them eat, speak, and feel confident again. The best part was researching real patient stories because it helped me understand the emotional and physical impact of the surgery. But also the pictures I used, I think they're very good. The worst part, I was making it a little too long, but the information I did use was very good and helpful if you knew nothing about the surgery. And yeah, my favorite part about the semester was was definitely in the weight room lab we did, but it was very fun learning about the muscles and doing the workout. But I also like learning about the body, and that's the reason I took the class. The other thing I also love is a quarter presentation. We did it, we did do it only 2 times, but it really took me out of my comfort zone, talking in front of the class. But thanks to Coach Kerr, my presentation skills has improved so much. The citation and the end, Merry Christmas, Coach.